Hey guys, welcome back. This is Coach Flores. I'm going to be talking to you about learning objective 4, chapter 4. Okay. Describe some common sleep disorders, including risk factors and what can be done to treat and prevent them. Sleep disorders, known as somnopathies or dysomnias, are medical disorders which are negative effect on sleep patterns. Okay. The American Academy of Sleep identifies more than 100 sleeping disorders. The most common disturbances in adults are insomnia, sleep apnea, restless leg syndrome, and narcolepsy. If you're having problems after following the advice in this chapter, it's time to visit your healthcare provider. Okay? You may be referred to sleep disorder centers for an overnight clinical sleep study. While you are asleep, the center sensors and electrodes record data that will be reviewed by a sleep specialist who will work with your doctor to diagnose and treat your problem. So if you have any issues, the book will give you some suggestions on what to do. And after that, if you still have issues, you need to speak to the specialist. Okay. Insomnia, difficulty falling asleep, frequent arousals during the sleep, early morning awakening is the most common sleep complaint. Okay. Then we also have, let's see the next one. We have cognitive behavioral therapy for insomnia is one of the best first line defenses for people who can't get to sleep or wake up during the night and can't get back to sleep. Okay. So insomnia is probably like the main one that people have. Sleep apnea is disorder in which breathing difficulty is repeated and interrupted during sleep. Apnea refers to a breathing pause that lasts 10 seconds. Sleep apnea affects more than 18 million people, or 1 out of every 15, and the numbers are increasing. So the danger about that is in some cases people can pretty much stop breathing for more than 10 seconds, which can be fatal. There are two major types of sleep apnea: central and obstructive. Central sleep apnea occurs when the brain fails to tell the respiratory muscles to initiate breathing. Consumption of alcohol, certain illegal drugs, and certain medications can contribute to central sleep apnea. Obstructive sleep apnea is more common and occurs when air cannot move in and out of a person's nose or mouth, even though the body tries to breathe. Typically, the OSA occurs when a person's throat muscles and tongue relax during sleep and block the airways, causing snoring, or gagging. Okay, these sound occur because oxygen is falling below the saturation levels in the body. Okay, and it fails to stimulate the body's autonomic nerve system. Treatment for sleep apnea: the most effective method for preventing and treating sleep apnea is to lose weight, along with avoiding factors that appear to increase. The most commonly prescribed therapy for OSA is continued positive airway pressure. People with sleep apnea can get a better night's sleep by wearing a CPAP device, a gentle stream of air flowing continuously through the nose, connected to a mask. Other methods include dental appliances, which reposition the lower jaw and tongue, and surgery to remove tissue in the upper airway. Restless leg syndrome, also known as Willis-Ekbom disease, is a neurological disorder characterized by unpleasant sensations in the legs when at rest, combined with an uncontrollable urge to move in an effort to alleviate these feelings. It can also be loss of circulation in the legs. It's the most cases are unknown. Family history condition seen in approximately 50% of cases, suggesting some genetic link. So it might be hereditary, according to research. Narcolepsy is a disorder caused by the brain's inability to properly regulate sleep-wake cycles, results as excessive intrusive sleepiness and daytime sleep attacks. Narcolepsy occurs in 1 out of every 2,000 people in the United States, characterized by overwhelming sleep and uncontrollable sleeplessness during the day. Parasomnia include all the abnormal things that disrupt sleep outside the major disorders. Among the most common are circadian rhythm disorder, in which there are abnormalities in the sleep-wake cycle during jet lag. Okay, sleep-related eating disorder. If you eat late at night, chances are it might affect you when you go to sleep. Sleepwalking, eating an entire cake or bucket of ice cream at night, or go for a drive and do not remember it. Night terrors, in which a person wakes up frightening screaming, often known without probable cause. Sexsomnia, in which a person may have sex while asleep and have no recollection of the event. Bedwetting can also be factors for not being able to go to sleep. snoring may impair oxygen levels as well. Okay, that is all for 4.5. Thank you.